Hi everyone in the room here and also in the sites. I'm Emily Anderson. I'm Coordinator of Falls Prevention at the Injury Control Council of WA. And this behind me is our Dennis, and she is the Manager of Falls Prevention, and we're going to do a bit of a tag team here for presenting today. So thank you all for taking time out to come to this presentation on falls prevention and working with your community. Because we do have lots of different sites, and you guys in here are from the Pilbara, but we've got people from Meriden and Kimberley, we're not going to focus on one particular community, but we're hoping that with everyone's input, some common themes will come out of how you relate with your communities, because they're all different. What we're going to do is, first I'm going to change back to so you guys can see the presentation. Cool. So we're going to start with a welcome. So I'm just going to read my page here. So we respectfully acknowledge the elders and custodians of the Kariyara Nation, past and present, their descendants and kin. As representatives of the Injury Control Council of WA, we are proud to honour the Kariyara people and value this place of shared learning. We recognise the impacts of colonisation Indigenous Australians as active participants in reconciliation. We are committed to moving forward together in a spiritual and mutual honour and respect. As health professionals, we also need to be aware of the inequality in healthcare for Indigenous Australians. Okay, so today we're going to be talking about a few different things. So what is falls prevention? I know lots of you are from varied health backgrounds, mainly aged care, physios, OTs, but so we just wanted to briefly touch on it to bring some people up to speed if they haven't thought about what falls prevention, what some strategies are, what resources and services are available in your region or can you tap into statewide, identifying gaps, working together to help with these issues, working with different communities, and learning from each other and learnt experiences. We're going to try and keep to these topics to keep to time, but we've got a car park here in terms of we're going to write up some issues. If something strays a bit, but you still want to ask the question, please do. And if we don't know the answer, we'll try to get back to you via email or however you want to be contacted as well. So please ask any questions. Also, if you want us to help in any way that you see there's gaps that we're not talking about today, feel free to talk to us about that and we can try to assist going forward as well. I just wanted to clear up, I'm going to talk about clients in this presentation today. I know people talk about working with patients, working with the community. I'm just going to use the term clients just for the purposes of this. So what is Stay on Your Feet? Has anyone heard of Stay on Your Feet before? Anyone in this room? Yeah, good. We're funded by the Department of Health, and we target people over the age of 60 and people over the age of 45, people for Aboriginal and Torres Strait Islanders. And we aim to improve the knowledge, attitudes and beliefs amongst seniors that falls are preventable, reduce the incidence of falls and reduce the severity of falls-related injuries. So we put up the definition of a fall as an issue because often people don't recognise what a fall actually is. And so the World Health Organization defines a fall as an event which results in a person coming to rest unintentionally on the ground or lower level. People often don't actually recognise that they've had a fall, so it's our job to ask some questions and ask, have they actually had a fall? Have they fallen back onto a bed or a chair unintentionally? We would consider that a fall. So it's just about making people aware of what is a fall and how can we try to help them. We also say that falls are not a normal part of ageing, and we really try to push that, and falls can be prevented. That's our main messaging here. So why do we bother about falls prevention? We've got so many different diseases and issues going on with our communities. Why do we bother about falls? Falls are the leading cause of unintentional injury and death over the age of 65. 1 in 3 people over the age of 65 are estimated to fall every year. And they account for more hospital bed days than any other injury type, which is a bit crazy. by 2021, falls are expected to cost the WA health system 174 million. So that's why programs like ours are being funded and working with you guys to try and prevent falls as well. 1 in 3 who fall will require medical attention, and each week in WA there are 120 presentations to EDs and of people over the age of 65 as a result of falls. But as we all know, there's a far greater cost to the individual, the community and their families as a result of falls. Okay, I just wanted to briefly touch on our 9 steps to stay on your feet, just as a bit of background about why we have them, what they are, and just to make sure everyone's up to speed if no one's ever heard of falls prevention strategies before. So we have 9 steps, as you can see. They're all evidence-based, and they're actually in order of what evidence says is most important. So physically being active is the most important thing we can encourage our clients to do. Like with many other chronic diseases, you'll find that these are very similar strategies to many other chronic diseases that you're talking about. So I'll just quickly run through the key things that we discuss with each step. So being active, focusing once again on the fine 30 of exercise, choosing activities that people enjoy, and activities that include strength, balance and flexibility as key, obviously, with the falls push. Managing your medicines, keeping up-to-date medicine lists. This is what we would encourage our clients to do.
Thank you.
Hi, have we got someone new on the line? Hi, if you could just mute your microphone for now, that would be great. Thank you. Okay, we'll just keep going on with manage your medicines. So we encourage to take control of their health, ask questions about their medicines and get their medicines reviewed regularly, working with GPs and pharmacists. Step 3 is manage your health, so taking control of those healthy choices, take control of chronic diseases and long-term health conditions, and have regular health checks. Step 4 is improve your balance. So balance can improve by being active and managing medicines, but also seeking medical advice or strategies to help regain balance and strength and confidence. Walking tall is about doing activities that assist with balance and strength once again, walking upright and using appropriate aids that if necessary. Foot care and safe footwear. Working with podiatrists, if you have a foot pain, regularly get them checked. Wearing appropriate shoes that fit, not too tight, not too loose. Regularly checking your eyesight is step 7. So making sure people have had their eyes checked. And if so, are they going to implement the strategies that the optician has suggested, or can we help them with that? Eat well for life is step 8. So obviously eating 3 meals a day full of healthy fruit and vegetables, adding vitamin D into their life if possible, and drinking plenty of water as appropriate. Step 9 is identify, remove and report hazards. So maintaining good lighting, reducing clutter, maintaining pathways, and if seeing hazards, make sure it's reported and something is done about the hazard. So did anyone have any questions? I know I ran through those really quickly, but I just wanted to give a quick overview of the 9 steps as they are, and then we'll move forward. Any other questions? Okay, cool. So this next slide talks a bit about where you guys fit in the picture of falls prevention. We've talked about some strategies, but now we're talking about how you can use those strategies and link in with what else is going on around the state. So we've put you as coordinators, but you may be physios, you may be on the ground staff, whatever you may be, working with individuals and tertiary and secondary prevention, hopefully working with us as Standing Feet and population-wide approaches and primary prevention, and working with us having tools and resources and education, trying to help promote the falls prevention strategies and policies and practices that can be put in place, and hoping that you'll feedback to us with what information that you have that you can learn, that we can learn from you and you can learn from us. So, did you want to talk?
I was going to say the main message with this one is really if you can help us identify what we can do to help you, then you're going to get more out of this, because we're here to help right the way through the state and provide tools and resources and information to back up what you're doing locally. So the more you can feed back, tell us what we're doing right, tell us what we're doing wrong, and then we'll be able to improve. Sounds fun?
I just wanted to introduce our Standing Feet team. We've got Elsa and myself here today, but back in Perth we have Juliana, Sonia, Ali and Jenny, just to put a face to the name. We all have various roles but work across the program in terms of different resources that we provide, newsletters that you can also get involved with, working with volunteers. We have some peer educators, so if you're interested in getting some volunteers involved or feeding back and forth about how to work with volunteers, we have some people there that can help us as well. So just wanted to show you quickly, it's also in your slides if you wanted to contact us at another time. Just so we are around and we're real people on the end of an email, so feel free to get in contact with us. I just wanted to run through some of our resources that you could potentially use or may have used or may not have used with your clients. We have one resource called the Home Safety Checklist. We have this here. At the end of your slides, I've also got lots of links to many different sites. One of those is to the Standing Feet resources page, where you can see all these resources for free PDF, or you can get them sent to you. So just so you know that that's where that is if you need. This is your home safety checklist. Has anyone ever used this before or ever seen it before? Yeah, have you ever used it with your clients? Has it been well received?
With the non-Indigenous clients, it's been well received. With our Indigenous clients, it doesn't work quite so well.
Yeah, it's a common theme we keep getting, which is exactly why we're here to talk to you guys, is to get some feedback on where to move with these. Should this be used as a toolkit for the health professional instead, or should it be more, or should it be less? Should it be pictures? Should it even exist for some clients? So that's kind of what we're here to talk about today. For those who haven't seen it, it is a simple checklist of room by room around your home of what you can look for in terms of hazards. It can be useful if you have never thought about hazards in the home before. It's a good start on the kit. Obviously talking to your OT or whatever is another way of linking in with that. But feel free to have a look. I've got some in the room, but I can also send out links to the electronic resources. We've got DVDs. They are getting on the old side, but they do talk about the 9 steps to Standing Feet. We have recently found that quite a few hospitals, specifically regional hospitals, have been using it as in waiting room kind of education, or so they literally just play a loop for some people. I don't know if that's of interest, but that has been done. We also use them for presentations, so if you're interested in giving presentations or giving some education tips, then that's one resource that you could use as a tool. They're also available to get from us for free. We have these 9 steps to Standing Feet flyers. They have more recently been developed. Has anyone used these before or seen them? Yeah, cool, that's fine. Run through the 9 steps, have some questions that can be kind of prompting kind of questions. So has it been more than 12 months since your eyes were tested or your glasses were checked? Those kind of questions, just to prompt. The idea being maybe you'll take this along to your GP, and if you've answered no or you're unsure about some of these questions, that you can take it to your health professional and ask them questions and kind of take control of your situation if you're worried about it. Does anyone, anyway, that's, we'll move on to the next one.
I was just going to say, before you move on, this has recently been redeveloped in terms of being more accessible for people who've got poorer vision. So a lot of the resources have been developed in this way, and there's quite a few principles to think about when you're designing your own materials, about what font you should use and sizes, and not using pictures behind text and things. And if you want any more information on that, you can email us and we can send out details.
Do you guys create your own resources for, do you create flyers and pamphlets for your own programs or educational material, or not really, it's more discussion? Yeah? Yeah? Not really? Yeah? Not fancy. Well, that's why we were wanting to know whether it'd be useful for us to help you develop some, if that was what you're after. But so create templates or fact sheets of what to put onto a resource to make it friendly for visually impaired or different backgrounds, that kind of thing. I don't know if that would be of use. Maybe. I'll move on to our next one. Our next one's up off the floor. This is one of our more popular resources. I've actually got the old version in hard copy. We've actually more recently got a new model for this. We used to, for some reason, have an Aboriginal one and a non-Aboriginal one, for some strange reason. But now we've got an Aboriginal model who's doing both of them, and the up off the floor is a magnet with it's a magnet, so you can chuck it on the fridge. So you're more than welcome to have those. Obviously, we're about preventing a fall, but we know that falls still do happen. So this is like an action plan on how people can get up off the floor.
And just say as well, there's actually two different versions of this as well. There's the forward method to get up off the floor, or the backward methods, and it's basically one's an easier option if they're not able to get up off the floor for the other way. So they're both created as a step-by-step resource that physiotherapists could work with the client, identify which one was best for them, and they've got the visual record to remind them.
We also have large booklets that detail the 9 steps to stay on your feet in large version, large font, and more detail about each of the steps. These are available as well, so I just want to share that one. Okay, so we also have electronic resources. We have an e-directory with physical activity falls programs. Currently, there's a few regional ones. I'm not sure that there's any Pilbara falls physical activity programs. We've got these cards. We'd love to hear about what falls programs are happening around and the area that we can promote to other falls practitioners, or not even falls practitioners. So people that weren't expecting to learn about falls, but their client might be needing some physical activity that is falls specific. Please let us know. I'll hand these round and I'll send out the link as well to the e-directory. We also are going to be starting Equal Injury Control Council forums to post questions and topics. If you're wondering, this is kind of to improve communication amongst sites. We've often found people are trying to reinvent the wheel, so it's about being able to post questions or topics that you want answers from that people may have already dealt with at another time. So it's kind of discussing what's available and how you can work solutions out together. We're also working on Facebook and Twitter accounts. So if you're involved, I don't know, being Department of Health, do you struggle to get on there?
We're exploring that option at the moment. It's not allowed for employees to access it, but we are looking into using it as population health, but that could take a number of months to get off the ground if successful.
We need most people
Well, we've had the same journey, and we've just been given permission to bring Stay on Your Feet to social media as well. So yeah, we've just landed in a gentle land in Facebook and Twitter, and we'll come in LinkedIn as well. So we'll see from there.
Yeah. So I'd encourage you to push that if you can, because it's obviously a great medium to share news and information of what's going on. We also have an e-bulletin that goes out about quarterly, but we're probably looking to do it a bit, push it a bit more regularly. This goes out to health professionals all around the state. If you have a story that you want to tell or a program that you'd like to promote, please let us know. And we'll be more than happy to send it around. If you're not on that listing, please let us know and we can sign you up, and we don't send them out that regularly, we promise, to block up your emails. So, and also we have all these resources available electronically, so you can print them off yourself. From evaluation we did last year, that was a big finding from our evaluation of our program, is that push to have everything electronic where possible. So coming soon, from some of our evaluation and talking to other people, we're going to be having some physical activity flyers, mainly under balance, flexibility and strength. There's just maybe 3 to 5 exercises per page, so hopefully those could be of use to you as a tool to give your clients to do at home and practice at your session, or to promote with other health professionals. But we'll once again join up to the e-bulletin, and we can send them out as a tool for you to use going forward. So otherwise we can link with you newsletters, regional networking groups, DVD, as I mentioned, there's various uses for that. Slideshows, we have a variety of presentations that people have done through, over the last couple of years. So if you are looking to do presentations to either other staff or to community members or clients, then please let us know and we can try to send those out. We have activity examples. So for example, we have Vision Australia have these glasses, I don't know if you've seen them before, as examples of different eye conditions people can get as a sample of what it may look like, for example, to have cataracts or to have other conditions, as a way of trying to encourage people to see their optician regularly. They're all free and can come from Vision Australia. Once again, the link's on the back page. Other things include, I don't know, if people are interested in Webster packs. These Webster packs, the sample ones, can be ordered or down online as well, when I put the link at the back as well, if you're interested in doing demonstrations to your clients or whatever. Where am I? We have pull-up banners and merchandise that you're more than welcome to use, or we can send out to you. For example, we have eyeglass pouches, which are cleaning pocket things for your glasses, as a way of keeping your glasses clean, which is important information for your clients. There's also pens and whatnot. So if you're having an event that you want to promote falls prevention, let us know. We have training toolkits, and we can organise training for specific organisations or specific target groups that you're wanting to get in contact with. And we want to know what else you would require to help you promote what you're doing and how you're helping with falls prevention as well.
I was going to say that as well, that all of our presentations or training sessions tend to be video recorded and are available up on our website. So at the moment there's 22 different educational sessions up there, including when people have came interstate, or I think there might even be some international people in there. So if you have got some time out to look into some training, then is some there available just to download off the internet.
I just wanted to bring up some of the research that's been happening around the state that may be of interest. We've had our peer education peer presenters being evaluated at the moment. We have a pool of around 10 senior volunteers who have been trained up to present to other seniors, hence the peer presentations, to present on falls prevention. Notre Dame University are looking at that program and seeing how it's working and what can be improved over the next few years. So we'll keep you posted with how that's all going. We also had the Standing Feet program evaluated in terms of how it's being promoted throughout the state. So thank you to anyone who was, I don't know if anyone was involved with that evaluation, but also the Standing Feet Week or the April No Falls evaluation through Curtin. We're also part of a Respond program. So this is Australia-wide program run mainly out of Monash, but in Victoria. But we've also got a pilot happening in Metro Perth, where the premise is to respond to the first fall to prevent the second. So it's tailored education and discussions with the client once they've had a fall to try and prevent the next fall happening. So trying to get them into physical activity programs, into getting the help and services that they require. So really tailored education, so we can keep you posted on that as well. Training that's happening. There's the Older Persons Initiative Coordinators meeting that's happening next week, and Justine is going. So we've got the Australian Physio Association event happening on April 5th, which you may like to webinar in. That's happening with some of the. We've got Tony Petter, who's a fall specialist. We've got Nick Waldron, who's the lead of the Falls Network, and Anne-Marie Hill, who's a guru in Falls from Notre Dame University, all speaking. So if you're interested in attending, let me know and I can try to get you involved.
So what was that one?
The Australian Physio Association, April 5th, Saturday webinar. I can send you the link.
Is it going to be recorded?
It is going to be recorded as well. Yeah, exactly. Yeah. So yeah, just let us know. It's fine. And also Monash University is putting on a knowledge to action in falls prevention across the continuum of care. That's happening in Melbourne, unfortunately, but hopefully we're bringing some information back from that to present on May 26th. Once again, we'll either video conference or webinar or record, so try to get you involved with that as well. Other research that's been happening, the New South Wales Falls Prevention Network is a really great website and wealth of information if you're interested in finding out more information. I put their link at the back as well. They are great at research, great at other falls prevention initiatives. They have the Active and Healthy website, which is very specific to falls physical activity and a good place to start and get some information. There's the Australian and New Zealand Falls Prevention Society. They're hosting a conference in Sydney in November, if that's of interest. I'll put the link on your slides. The Cochrane Review, has anyone used the Cochrane Review before? Anyone? Yeah, okay, cool. I put the link to falls prevention in the community summary, if that's of interest to have a review. Also, Neura is based in New South Wales, and they're once again a really great research organisation focusing on many things, but falls prevention is one of their key areas that they look at and come up with some great initiatives. One of the ones they've come up with recently is an app that's about fear of falling. So simple, and so if someone's doing their vacuuming and they can rate a scale along the bottom in terms of how comfortable they are doing that everyday activity, and it comes up with a score at the end in terms of their fear of falling rate. So just one example of the good things that they're doing. I just wanted to talk about the services you might like to tap into. Have you guys ever linked into the Fall Specialist Service in Perth? Each one of the metro hospitals has a fall specialist located at it. Welcome. They also link, each metro hospital links to a regional area. For the Pilbara, it's Bentley, and for the Wheat Belt, is Swan Kalamunda. But I've got all the list of the different regional sites and their contact details. They're a wealth of knowledge. They're mainly physio and OT based specialists. They have many activities based on the Otago program. I'm not sure if you've heard of that before. We also work with them to deliver presentations, but their world is full. So if you're interested in finding out more about, if you've got some frequent fallers, if you've got some tricky cases, they've probably dealt with it before, so you might be interested in getting in touch with them. Just wanted to bring up community care organisations and training opportunities, that just the importance of home and community care staff and other community-based services that aren't always specifically health trained in their role in falls. We were talking about this earlier actually in terms of how many people, if someone has a fall, they often get a HAC staff, and then they get a physio staff, and then they get a few different people coming into, so it's about talking to all the services that are going to these clients' premises and chatting about how they can, all the different services have place in their getting better and reducing their risk of having another fall. I just wanted to bring up referrals and pathways. Where does your service fit in relation to falls? So we say that falls are everybody's business. Have you linked to your podiatrist lately? Have you linked to your optometrist lately? What about the pharmacist? Have we asked about medication? What about emergency and ambulance? Do you have ambulance services here or not? Yeah? Do you guys link with your emergency ambulance services in terms of calling up? Not really? Not really. Could be an idea to, well, one thing we found is that emergency and ambulance obviously have a role to play in if people have a fall and call and need help at their home, but not necessarily they don't end up at hospital. So there's that link there in terms of how do we access those people who are still at home but not coming into hospital to get services. Okay. Does anyone have any questions so far? Anyone on the sites have any questions? No? Okay. Falls prevention exercise programs. I've heard there's a few that happen here, and just wondering, well, I've already brought up the e-resource, and it'd be great if we can promote your programs. Wanted to talk about Otago and it being, it's successfully demonstrated by physios and nurses to be run. Also the Stepping On program. Has anyone heard of the Stepping On program? Yeah, have you used it before?
Not here.
Not here? Would you be interested in getting training here? Or not sure? So it's education and physical activity based I think it's over 8 weeks program. It's come from over east, but they are interested in coming over and getting some training in those kind of things. Same with Tai Chi. We've had lots of interest in different regional areas about having Tai Chi regularly. And we've also been working with Arthritis WA and a few other organisations who do deliver Tai Chi training. So it's finding out about who is interested in learning a bit more, and would your community be interested in the uptake and that kind of thing. So happy to discuss that as well. Stepping On is another one of those programs, but it's also about people ideally giving people options of what they want to do and how can we get falls into everyday activities. There's more and more evidence coming out all the time about different activities that can reduce the risk of having a fall. For example, table tennis is one of the more recent activities, and Wii Fit and Xbox. We know the Seniors Recreation Council has done some great stuff. I don't know if you guys use Wii or Xbox at all?
I'm not Wii's over at Clara House, but I think they went missing.
Sorry, Kimberley.
Yeah. They have been used successfully, but they're not consistently used.
Not consistently? Cool. Okay. So Tai Chi could be something that could be of interest, yeah? Okay, cool.
We did the Otago program.
You do the Otago? Do you find it successful
Yeah, I think it's really good.
and easy to use and implement?
Yeah. I think the problem is, well, we've just had, if it's not run well,
Yeah.
then you're not really getting any benefit out of it.
What made it not run well?
Because it's basically a strengthening and balance program.
Yeah.
And if people aren't motivated or people running aren't forcing people to do it properly, then
Sure.
and it's quite repetitive, I think.
It is quite. Yeah.
I think the group that we've got, sorry to interrupt, that do it have been coming along to this class for years and years, and so they're like, oh yeah, I know all this, and they skip through it really quickly, and you're like, okay, you're not actually doing the exercise correctly anymore. That's not actually the exercise you're meant to be doing. So yeah, I think they go, yeah, I know this, so doing something different might be great. Yeah.
I'd like to find out about that other program.
Yeah. Okay, that's good feedback. Yeah, we can definitely send you information, and the interest is what we need to get people over here to get more people trained, because the more people that know the different programs and how to implement it, the more variety we can give the community. So, did you have anything to help add about that?
No, I mean, just what Emily said is definitely, if we can offer activities that people are interested in and that mean that they don't get bored doing the same thing, then we're more likely to get compliance. So we have proposed that we do more work looking at how we can incorporate falls prevention into other activities to mix it up a bit. Maybe in terms of you have something else and then you have warm up and cool down, which gives a lot of the falls prevention element to it, but you have something in the middle which is more varied and keeps people engaged. So,
Thank you. Cool. So just wanted to talk about what's happening around WA. Have you guys got involved with April Falls at all? Yeah, there's events happening. Fabulous. So that's about educating staff and awareness raising of falls generally throughout the state. We have around 100 events happening this year. Some people are going to great lengths to have ward competitions. I know Charlie's, each ward is coloured in different, they're all green, but they have competitions as to who's the best. We just want to talk, we're doing more events and displays more and more. Recently we've been partnering with the Practice Nurses Association as an example of different areas that we're targeting. We find it really difficult to tap into the GP market. I don't know if you guys struggle to get in contact with your GPs regularly. Is that a common theme, like to build that relationship?
We now have permanent GPs.
Sure.
So every few months there's a different GP, and whatever correspondence you've had with the previous GP seems to have been lost.
Right.
And so it's starting over every few months.
Yeah.
which is challenging. So a lot of the time, well, I don't know about the other disciplines, but we usually don't bother corresponding with the GP because by the time the person goes back, it's a different GP and they don't know anything about what's happened anyway. So
Yes. So what's your referral pathway if you're needing some sort of GP?
or we refer to them if it's something that we need to have assessed,
Okay.
but we don't feed back to them as
Right.
to you referred for this.
Yeah.
This is what happened because a lot of the time they don't know about it. So
Yeah. Okay. Do you work with other people within the practice, or like the practice nurses, or is there a clinic coordinator or anything like that, or is that same deal as staff turnover?
not so much about the other groups, but yeah, I think there's key elderly clients in the community that it's best to talk to the practice manager because they're the ones that are most consistent.
Sure.
But as far as specific falls prevention stuff, I would say from observation it's not really their focus.
Sure.
A lot of it's more medication orientated and things like that. So it's quite challenging.
Yeah. Sure. Thanks for that. So yeah, we're just trying to get in different ways because we know the GPs are a challenge often in many settings, busy people or staff turnover or whatever. So just trying different avenues. So if you have any suggestions on who else we should be tapping into, please let us know. We've always doing different education and training, and we have over the last few years had grant opportunities for different regional groups. So I just wanted to talk about what's been happening around WA. In the Kimberley, I think we have someone on the line from Kimberley. There's the Who Falls DVD. Is that still being used in the Kimberley?
Hi, I'm from Kimberley Aged Care Services, and I'm afraid I can't comment because I've been here 2 weeks, so
No drama.
sorry about that.
That's cool. That's all right.
Apologies for that.
That's okay. Thanks. From what I know is that Solange Rousset, who's been at the Kimberley Aged Care for quite some time, created this Who Falls DVD. It's focused on Kimberley community and is a cartoon-based resource. So just thought I'd share it with you as a different type of resource that has been happening around WA and is region specific. Has been around for a while, so I'm not sure how often it's used these days, but it does exist, which is exciting. Another program that we funded was Kalgoorlie. Last year they trained over 20 health professionals in Tai Chi, which was fabulous. They've now also, and a variety of people, so people in physio and OT, some hack staff, so aged care services, so a variety of participants, which was great. They've also started a group after to keep up their skills to make sure they practice regularly, because unfortunately we couldn't, there's not a lead trainer in WA, so we had to bring them over from the east. So it is possible, and they've really loved it and have continued to perform the Tai Chi in their home and community care groups and in other community groups as well. So it was great success, that one. In Mullawa last year, the health promotion staff worked with local community groups to create some radio clips promoting falls prevention in their own words. So I'm not sure this is going to work, but we'll have a crack. I don't know. Is that going to work? No.
I think double click it.
No. Okay, that's all right.
I think it's about it, but it's not going.
Okay, that's all right. Anyway, they were beautiful. People speaking from their experience, for example, the baddie ladies, the badminton ladies, getting involved with how they get involved. They stay on their feet. they get involved with their community group. There was also someone who always picked up their hose after their gardening. Very simple things that came from their own voices, and they were played on the radio for Standing Feet Week last year. But they're also on file so people can, they can play them more regularly, their community service announcements.
And they're on our website, and
Yeah.
if you want to go and look, and there's
Yeah.
other case studies as well of how grants were used last
Yeah.
year. So
The key themes that came out of these programs that were quite successful was that they knew how to connect with their community. They worked on with a variety of stakeholders within the community. It definitely wasn't just one organisation. It was many people within that community setting to make these projects work. The Great Southern also are looking at delivering some more community presentations throughout their region on falls prevention, and another southwest town was running some educational and physical activity sessions, and they've approached their local government to and they've now secured some funding to run it for the remainder of the year. So another win for falls prevention and seniors in that region, which is great. So what do we know about engagement? So moving on from that, what do we know about health literacy? Do you guys know the term health literacy? You guys? No? Cool, that's fine. So in terms of talking about someone's health literacy, it's understanding the terminology of health. So key things to talk about in terms of health literacy are: don't assume your patients understand what you're talking about. It's explaining really simply what you're asking them to do, why you're asking them to do it. Realising that some clients may feel embarrassed to admit that they don't understand. And providing, printed materials or having something, a take-home message or a DVD, or suggest that they bring a friend or supporter or health buddy when you're talking to them. And tailoring communication for your client or patient. So knowing their educational background or previous experiences at the time. So that's, did you want to talk about? No, that's fine.
That's good.
Cool. So does anyone know the term self-efficacy? No? That's fine. So self-efficacy is about, unless people believe that they can do or produce the desired effects by their actions, they don't really want to do it or don't have any intent to do it. So self-efficacy influences goals and aspirations. The stronger perceived self-efficacy, the higher the goals people set, and the firmer the commitment to them. So it's really important to get someone to believe that they can get involved, believe that they can do the task that they're being asked to do. We also talk about tailoring, so targeting the development of an intervention or tailoring the task that you're doing to that person. So instead of using all 9 steps that we're talking about, let's just choose 1 or 2 that the client actually needs to work on to move to help them reduce the risk of having a fall. Has anyone heard of motivational interviewing before? Yeah? Have you had training in it or? No? No? So
might be useful to do.
yeah. So we have some a video of a training session that we put on a year and a half ago now. So if you feel like I think it only runs for an hour and a half. So if you have time to have a read through that, we've got a psychologist in to talk about motivational interviewing and how you can talk to your client and ask them the right questions and get them thinking about how they can get involved with the activity that you're asking them to do, and believing that they can do it once again. We also have Anne-Marie Hill, who's researcher from Notre Dame University. She's a physio background, but also has done lots of research in education and how working with clients. So she's got a program, a session that we videoed, the role of patient education in preventing falls, on our website as well. So feel free to have a read through that, listen to that, could be of interest as well.
Just to let you know as well, I mean, Anne-Marie's done some really interesting work about the use of novel techniques in terms of engaging people and encouraging activity or action. And one of the things was, she's got a physiotherapy background initially, and was looking at in terms of when people are getting given exercises from the physio, using, if they have a smartphone or a recording device, using that to record them doing the exercise. Then they've got a record of it to take away with them. It becomes a record that they can then repeat at home because they can see what they have to do. And then also as they go through time, they can see how they've improved. So that's just a new piece of, it's a pilot at this stage. It's something that hopefully will go further, we'll get more evidence behind it, but it's about using technology that is increasingly becoming available to help people comply with programs. So.
That motivational interviewing video, is it just for falls prevention, or is it?
No, it's general. Yeah, general health. We did ask him to focus on falls specifically, but general, that was only a small portion of it. It's more the principles of motivational interviewing. So yeah, more than welcome to have a look at that. Yeah. Where are we at? Okay. Cool. So what do we know about falls? Are these some of the things that your clients would discuss with you about falls? It's not about me, it's about someone that's older, too old. I'm not old. I was just clumsy when I fell, or I just need to take my time. Is that a normal thing to hear?
Some of yes, they're just like, I don't know before, I was just short of breath at the time, and I'm not going to fall again.
So how do you respond to that?
Well, it was an interesting case. It was obviously like osteoporosis related, so I can explain there's other reasons. But probably, yeah, your bones aren't in a good state.
Yeah.
So that's the falls.
Yeah, so it's a common discussion that's had with many health professionals and their clients regarding the perception of where they fit in the falls scheme of things. We often find, as discussed earlier, that it's often similar things, some chronic disease issues like physical activity and eating well, that are common themes that come through with falls as well. Do you find that as well?
Yeah.
Yeah.
People that don't look after themselves.
Yeah, that's right. Yeah. So, and that's why we wanted to bring it up, because we know that falls doesn't always come up as the priority in terms of health needs in different communities, but we just really wanted to mention that it's often many of the factors that play a role in the falls. It's never just one factor. So,
I mean, falls really, that's why it's defined as a syndrome. It's, you know, it's got all these different factors, and the fall is just a symptom of everything that's going on. So that makes it more complex in terms of being able to identify and prevent the falls. There's more than one thing to consider, which is why we've got these 9 steps as a tool. And what's come out of our evaluation is that, you know, really these tools are for us more as health professionals. We can't bombard the person so much with the 9 steps. We have to be able to focus in and say, let's look at this bit first, and then we'll also go and see other things.
So how are you going to connect with the community to discuss falls? So what is it that people in their heart and minds feel that they impact on their health and behaviour? How can we work with them to promote health, in promoting health? So I've just got a little quote here. If you wish to help a community improve its health, you must learn to think like the people of that community. Before asking a group of people to assume new health habits, it is wise to ascertain the existing habits, how these habits are linked to one another, what functions they perform, and what they meant to those who practice them. So that's from Paul, 1955, so quite a while ago. So it's stuck around for quite some time. So does anyone, we just want to put it out there, we don't have all the answers about how we're going to connect with our community to discuss falls, but we just wanted to start a discussion on how we think that's going to happen. And we just, as everyone knows, as clinicians or as people working with, with people on a day-to-day basis, everyone is individual, so we're not going to have answers for every client that you're going to run into, but it's about appreciating each one for who they are and what their individual concerns are. So we wanted to talk about, we also wanted to talk about the reasons for human behaviour. That's right. So we wanted to talk about impact of values, attitudes and beliefs. So I'm going to move here. Okay, so we wanted to have a bit of a think about, spend 2 minutes of your time thinking about a client that you've seen in the last, if you haven't had a client in the last 2 weeks, think about a family member or someone maybe more senior to you. Think about what they value in their life, their home and their health. Do you mind spending a couple of minutes? What do they value about their life? What do they value about their home and what do they value about their health? Spend a couple of minutes thinking about that. That's right. Okay, we'll come back together now. Does anyone want to talk about what their client values in terms of their life, home or health? Does anyone have any? Does anyone value what they value at their home? Does anyone find their independence? Yeah, great.
And their choice to be there.
Choice to be there at home, yep. Their relationships, yep. Any others?
There's something about this stuff, you know, the stuff's always been there.
Definitely.
It belongs there, and that's where it's going to stay. You know, it's
Yeah,
like
definitely.
everything in its place. Yeah, you know, you've changed.
Yeah.
Before, I need to adapt this house. And
Yeah, definitely.
There can be like denial around ageing and their limitations. People just don't like to admit that they aren't capable of the same things that they were capable of 5 years ago or something. And like that can be what makes a person stubbornly go on doing something even though their kids or grandkids are going, oh, I really don't think you should be doing that, you know, these days.
Yeah. So how do you think that affects how your, like the grandkids or the kids will talk to them or?
From personal experience, in my family, it was at the point where where all children were saying that my grandpa shouldn't be driving, but none of them had actually been in a car with him for many years. So I tried to stand up and I put out I'd been in a car with him and I thought that someone should actually go for a car drive with him before they start making too many decisions, because they were gossiping behind his back, and that's not a nice thing for a parent to have, I don't think, to have their own kids gossiping about them like that.
So that's a good example of, obviously you're dealing with more than just your client. You are dealing with your the client's family members and what they think and their values and attitudes, let alone the client that you're dealing with. So thinking about that, how does those influences impact on the behaviours of someone? If you have attitude that everything in your house, your stuff is yours and it has to be in the right place, how's that going to affect your behaviour?
it becomes, you know, it becomes stuff you don't want to change.
You don't want to change.
You don't want to change or threatening, and you know, like to say, you know, what are you trying to say? I'm getting old. Yeah, I'm sorry, you're only in your 80s here. You know. That's right. Yeah.
And it can be quite confrontational as professionals. You're going in and you're saying, that rug is really a trip hazard. I'm thinking, I've had that rug for 40 years.
Been protecting the carpet underneath for 40 years, I can't.
Yeah.
So obviously, there we go. So just wanted to, I'm not sure if you've seen this iceberg model before, in terms of what we've talked about earlier in terms of values, attitudes, beliefs, what they're knowing. So we're giving them education. They have already inbuilt values and beliefs. They have motivation, or lack thereof. But what is that? We're only seeing the behaviour. So it's about delving down into the client, asking questions, taking time out to discuss with your client. What are their beliefs about certain issues? What are their beliefs, their motivation to change? If they're not motivated to change, do you still try and give it a go? Yeah.
Motivational interviewing techniques.
There you go. Top of the class. So yeah, we just wanted to bring this up as so we always want behaviour change as to try and prevent falls, but we know that majority of the effort is going to be seen probably need to happen under the water in terms of this iceberg model. Did you want to put that one? Yep. Did you want to talk?
Yeah, this is just something that probably just take away and do, I think, in terms of timescale, because we're due to finish.
No,
We're actually okay for time. So maybe I'd ask you to take a couple of minutes to do this. It's about identifying your own values, because the whole belief is that how can you work with other people's values in order to try and drive behaviour change if you're bringing your own baggage of your own values which might be getting in the way. So this little exercise is just looking at a few different points which would highlight your values. So you can just draw this shape on the back of your paper if you've got space. And then it's about looking in each of the sections and answering those questions. The idea of it is that the ultimate is if you can do it symbolically and have a symbol, then you end up having your medallion of really what drives you as a person. But you can equally use words in this sort of short, sharp identification of your values. So if you can take a few minutes to look at that, and then share what you've got with your neighbour next door, and then explain what your medal says about you.
Yeah. How about for the people on video conference? Some of them don't have neighbours.
So anyone who's not got a neighbour, there is in Kimberley.
If you're on video conference and want to share, feel free. Otherwise you can keep it to yourself, whatever you feel like.
Pending. Yeah. Pending one day.
I draw the recliner. Tea.
Oh, tea, that's tea. Shift from the
Okay, so I'll get everybody to wrap up that in a minute.
I know, that's what I was thinking too. At the time it was good.
So if you can share what you've written with
probably
Yeah.
massage, kitchen with friends,
I saw pool.
and one of my mentions is stuff.
One thing.
Good start. Have you ever travelled for
Okay, so we'll bring everybody back together again. So basically, the idea of this is unless you know somebody's values, you could be giving them the completely wrong message. A really good example of this is anti-smoking campaigns that are directed at teenagers. Now, if you're going to talk to them about lung cancer and premature death and all of that, it's not really going to hit the spot. The innovative ones that are more likely to reach them are ones that are not more talking about their image and smelling and nobody wanting to kiss them and all of these things. You have to actually find what switches somebody on. So with falls prevention, one of the values that was mentioned was independence. And maybe it's about dumping the negativity of falls prevention and thinking about independence and working, but it's doing that work in terms of identifying values. And although that we're talking about the individual there, it's also important to remember that culture is really shared values as well, so it works with groups as well and populations. So that was a little bit exercise of that.
Cool. So we've talked about a few of the barriers that you guys come across when dealing with clients and referrals and services. In terms of, we've mentioned staff turnover and the GP staff turnover. What other barriers do you guys come across in terms of delivering a service that would affect falls prevention?
I think it's access to the services, even just physically getting clients to
Sure.
sessions.
So proximity, or just
transport,
transport.
just remembering appointment times.
Sure.
How,
Funding.
and how your clients prioritize whatever they want to do.
Sure.
For our clients in dialysis, sometimes it doesn't seem that their dialysis therapy is one of the priority 5 in their list.
Yeah.
So I think working with the clients and identifying how they prioritize their activities and what their goals are.
Yeah. Is there any other barriers that people?
Because of the way some people live in the housing crisis and stuff, sometimes people are living in extremely overcrowded situations and they don't have any control about who's in the house and what's in the house. So that would be difficult for some people.
Sure.
One barrier that hasn't been mentioned, I'm just thinking because it's the Pilbara, and this is also probably relates to Kimberley, I'm guessing, is remoteness and what delivery of services to people in remote locations who are outside of the urban centres. Is that something that clinicians struggle with, or would that be more for the people living in the more remote towns? An issue?
prioritise their appointments with a health professional above social activities or something else that they might be doing. So we could be flying all the way out to a remote community, but everyone's left town because the football carnival's on, or something that is just prioritised higher than a health appointment.
Does technology help with any of the proximity issues?
Still not much technology out at the
Sure.
remote community.
Yeah.
Some of them are good, they like to do VCs.
I think one of the barriers too is people just don't, I think maybe the falls issue is like high for us because we, deal with it and see what the repercussions are, whereas maybe the clients don't actually get what the big deal is, what the end result is that, why we're worried about them breaking a hip or, having a wrist broken.
Yeah.
So,
Well, they just don't know, that how much of an impact that's going to have.
I think also there's the impression that a fall is a once-off incident rather than realising it's actually a symptom. And because when you've fallen once, you're more likely to fall again. And that's one of the barriers that we have to overcome and realise that it's not just an accident that's happened to them, it's a sign that action is needed.
What's the time? We better wrap up. We were going to do a bit of an activity. If dollars weren't an issue, what would we do? Do you want to shout out a couple of random things? If you didn't have any dollar issues, what are a couple of things that you'd do to flip those barriers around? Or could we turn them into positives in any way?
Well, Rose and I are actually going to start up our own media unit and make little videos that would show in health campus. So while you're actually waiting in A&E or at outpatients, you could have actually a variety of different health messages.
Because that's actually doable. And not on a big scale cost. Superstar, exactly. So, any other ideas that we think are big dollars, but not necessarily big dollars? Any other?
I think being able to do exercise and education in people's homes and being able to really personalise each and every individual instead of trying to generalise for a
Group
population.
programs?
Yeah.
Instead of group programs,
Yeah.
individualised?
And because with the group therapy, it's the person then has to make their way here, and there's a lot of factors that can impinge them actually attending.
So once again, would technology and videos help? Do people,
Not in people's homes.
not in people's
No.
homes? No, okay.
No, because I think that person to person and
Sure,
really making
okay.
a personal service.
And that helps in motivation. If you're
Mm,
just seeing someone one-on-one.
that's right.
No, people do watch DVDs a lot,
Yes.
and they are trapped in their houses for long periods of time.
Yes.
Other family that can help them play with DVDs is a problem.
Yeah.
The other thing we have in here, because of the weird layout, I guess, is we have a lot of little tiny little parks and little triangles of grass and stuff like that. I just wonder whether when winter comes, when just winter opportunities, if you could, let it drop within a few blocks and have a little exercise session or stretch session or something in some of these little parks to have a little go and see who would turn up. I mean,
That's
I just never know, because we've got these exercise stations. Don't know if you've driven around.
Yeah.
We've got some exercise stations in some of these main drags.
Yeah.
And it's quite surprising the age range and the background of the people who are using them now at various times of the day and night.
That's great. That's awesome. Another new story.
If I had unlimited funds, I'd make things like the gyms all free so that it's much more accessible. Because especially up here, it's so expensive.
Okay.
And a lot of our older patients we're trying to keep active, but it's too hot.
Would
to
they be
exercise.
interested in attending the gym, do you think?
I think so. We've had some good success with getting
Awesome.
clients.
Right.
So yeah, but it's just that there's not much you can do during the day to stay
No,
active.
yeah.
You kind of like, well, if you want to go for a walk or something, you have to go early in the morning and the evening. So
Yeah.
and also the group mentality, group exercise can be really motivational as well.
Right, okay.
Well, maybe even if you had a personal trainer to kind of help, take them down and show them the ropes and feel comfortable. Or go into the pool.
There's been
been an interesting drop-in Tai Chi class being run for Aboriginal communities in North Perth metro area, so we're waiting for a bit of feedback on how that's been going. It was tied in with a drop-in podiatry service as well, so people were able to go and see one and maybe get the other checked as well, or involved in the other one.
We are from the Aboriginal Medical Service in Perth, we're running a heart health thing and have been doing it for many, many years on a Thursday. And they're incorporating a lot of different activities. And our group could get up to about 30 or 40 people, quite amazing to go and see. To sit there over a few weeks to see what visitors are coming in to help educate and support these families. And they were doing some things like modified dance, sort of like modified bird scooting or modified zumba, really simple and stuff like that. Really great.
Yeah, we went along and all specialists came along and we did some Tai Chi demonstrations with them as well. It was fabulous. They loved it. Yeah. Okay. Well, thank you for that. That was a really great activity because there were some fabulous ideas that, yes, they cost money, but it's not like crazy amounts of money that we could potentially try and help with. So that's really exciting. So final thoughts. We just wanted to wrap up. If you could just write down one thing that you've learned today and one action that you're going to take from today, whether it be looking up the website to get some more training or contact us to be put on our mailing list or sending us an article so we can promote your service a bit more to the region or WA. So whatever, just make up those ones.
Can I just ask a quick
Go
question?
for it.
We did a webinar maybe a month ago
Yes.
on preventing fractures in the elderly.
Okay, do you know who is
I
that?
think it was Campbell.
Okay.
One of the things that he was really promoting is he said with the correct supplementation that they said 26% of fractures are prevented. And he said that's probably more effective than all the other fall programs put together. I don't know if you guys have an opinion on that. Do you think that that's an underutilised area? Because
Supplement in terms of vitamin D.
so vitamin D, calcium, and
Calcium.
phosphates.
Yeah, it's got
what they
big
say.
evidence.
Growing evidence.
And he was, he was really, and also using the online fracture risk assessment tools. Have you heard of
I
that?
don't know about that one, to be honest.
So there's a couple. There's one through the World Health Organisation, and there's another Australian one. And basically, you type in a bit of data about your patients, age, number of fractures previously, a couple other bits and pieces, and it tells you the risk of having a fracture in a couple of years. Because basically, they're saying if someone's had a wrist fracture, then they're already at increased risk of getting a fracture and things. So they're the people we need to start targeting. So I don't know. That's what he was really going with the research, was like really, as soon as you see someone who's had a fracture and is falling, then we've got to get onto supplementation straight away. So I don't know, it sounds like it's, when I've seen quite a few patients and you just see this risk factor coming up again, and it doesn't seem to be that supplementation is something that's commonly utilised.
It's been used more in specific areas, like in residential homes. It's more being promoted that as a way where you have potentially confused people, that other mechanisms are not particularly helping. So there's been quite a few studies that have looked in that. But it is also being used in community areas as well. And it's certainly one that the model of care has just literally today been released, the revised version in WA for falls prevention, and the evidence is in there as well.
Because he was really,
So are those ones that are looking at the retirement homes, are they in the supplementation, is that more for weight management though, rather than?
No, it's talking about vitamin D and calcium, more vitamin D, and obviously primarily as well where people are going to be deficient in vitamin D, so not necessarily universal supplementation but targeted, and that can actually help prevent falls.
Good question, thank you.
Yeah.
Thanks, guys. I've left evaluation forms. Please give me honest feedback, and if you don't feel like filling out here, I can send you an electronic version. I'll probably send one this afternoon, but if you've already filled it out here, then that's fine. so much for your valuable time, and we'll hope to be in contact over the next while.